frequently we are working with clients or approach clients or in discussions with industry or whatever setting about how can we avoid doing a pilot at every opportunity, at every site, you know, every location that we approach, whether it's in the UK or any other market. They want us to run a pilot. They don't, even if we've done pilots before, even if we, have good, strong RCT evidence, etc., etc. So this is kind of, I guess, once you've gone through that first innovation stage, you've identified where you should fit and where you have value and where you've demonstrated quite a lot of that data generation. And that's constantly comes up in conversation is we're constantly being asked to do pilot after pilot after pilot. How do we get out of this cycle? And it's really interesting. And I have to admit, it feels a little bit, it's unique to every situation. It is genuinely unique to the device or the medtech that we're talking in question. It's unique to the market that we are talking about. And it's very much unique to what's happened before. And so I think that's why all the cases and the aspects that Evelyn and Callum have kind of indicated and hint at are so critical to ensure that you don't end up in this constant pilot cycle. It's really understanding what they're going to need when you are running a pilot. It's about ensuring it's powered correctly. So it is valuable, it is publishable, it represents what it is going to replace or what it's going to be complementary to. And those are the cases where we've seen the pilots that have really been successful and that our clients have been able to get out of that constant cycle of being asked to do a pilot before anybody will even commit to funding them in the long run. It's those sorts of incidences. It's when they've thought about how is the data that I'm going to collect beyond just capturing a clinical benefit, how do we ensure we capture the system benefit in a way that is replicable for at least everybody in that market. So the UK, for example, is very interested in how long a patient is in a clinical setting, who are they interacting with in a clinical setting, which tariffs are being triggered, for example. So it's really important when you're designing these pilots is to try and future-proof and really think all of those aspects that people are going to want to see evidence for that don't come out of normal RCT type trial designs, and where pilots really allow you to do that. But if you focus too much on just we want to see what a clinical outcome is, time and time again we are seeing that people just end in this constant cycle of pilot after pilot after pilot. And obviously the more potentially disruptive you are to the system, potentially that's also, I think, something that we often see of people being asked to repeat pilots because they're kind of not able to explain and demonstrate how actually this disruption can be managed. It's not going to be painful forever. It's not going to need constant investment, at least from the healthcare system, and how they can see that trade-off quite quickly. So going back to the earlier discussions about understanding the care pathway and other aspects like that, they're the types of instances where we've been able to potentially shift the conversation away from we've got to repeat a pilot,